Okay, hi everybody, welcome back to our session. We have our next speaker ready. Just some housekeeping items. Do address your questions to the various speakers in the Q&A box. If not, the questions will not be able to see us because we have a mountain of questions. If the questions are not answered, you can go to the booths to ask for the questions. Okay, without further delay, our next speaker will be Lim Suk Luan from Singh Health. Suk Luan is the Deputy Director of Strategic HR at Singh Health. Suk Luan, you can take over. Thank you.
Okay, good afternoon, everyone. Welcome to this session where I will share with you the overview of Singh Health. If you attended some of the earlier sessions, you may know something about the public health care. So just a little recap. The Singh Health is the cluster taking charge of healthcare needs of the population in the East. It is part of the changes after the reclustering from 1st January 2018. And in Singh Health, we have 4 hospitals, 5 national specialty centers, few community hospitals in our Comcast, and a network of polyclinics. Our strategic partner is Nuhs in academic medicine. Based on the 2001 statistics, we take care of the largest medical needs of the population, with A&E account for 45%, specialty consultation is 51%, and for inpatient admission is 49%. Singh Health, being the largest, thus we have also the largest workforce in Singapore, close to 30,000 people in nursing, administration, allied health, medical, dentist, and dental support. From here, just the statistics that in the public healthcare, we take care of primary healthcare, secondary, tertiary, quaternary care, as well as continuing care. In Singh Health, we have 42 specialties across the group. We have, because of the 4 hospitals, we are grouped according to the campuses. So in SGH campus is located at Outram. We have the Singapore General Hospitals with the 5 national specialty centers, namely National Heart Center, National Cancer Center, National Dental Center, National Neuroscience Institute, and Singapore National Eye Center. KK campus looks after the women and children's health care. In Changi, we look after the population in the East, and over at Sengkang campus is the public health care over at the Northeast. And the polyclinic is also mainly in the East, and in the polyclinics, there will be services to look into disease prevention, primary health care, and family medicine. And generally, most of the administrators are based in Singh Health Connection, which is actually at Bukit Merah. Who are in our institutions? As mentioned just now, we have 4 hospitals. So starting with Singapore General Hospitals, the largest hospital in Singapore. And a few years ago, it was voted the 3rd best hospital in the world. And for some of you may know, this year is Singapore General Hospital's 20th anniversary. So there will be a Medicine 200 celebration across the Singh Health. Changi General Hospital is a regional healthcare system mainly for the Eastern population. There are many specialties at the hospital, and one of the most popular is sports medicine, where many of the young sports person who are actively engaged in sport and may have some injury, may from one time or another visit Changi Sports Medicine Center to get some treatment. Sengkang General Hospital is a new one that looks after the population in the Northeast and the surrounding areas. KK Women and Children Hospital is Singapore's only hospital for children and women. So it takes care of high-risk conditions in women and children. National Cancer Center is a one-stop center with the region's largest pool of subspecialty oncologists. So for those who are keen to be respiratory therapy, radiation therapies, Cancer Center will be a place where you practice your profession. Dental Center is integrated special care for dental condition. At NDCS, we just don't look after the normal dental matters like scaling, polishing, or braces. Actually, it's more than that. I'll explain later in some of the specialties and how National Dental Center is being integrated in the treatment of other medical situations. National Heart Center Singapore is a leading center for heart and thoracic treatment matters, and it's a center for excellence for treatment and center excellence for treatment of complex heart and lung diseases. National Neuroscience Institute looks into the treatment of neuro matters. Currently, it's spread over 2 campuses. One is at Tan Tock Seng, beside Tan Tock Seng Hospital. The other one is at Singapore General Hospital campus. And it has a world-first integrated brain suite, which the ability to perform complex surgery and greater precision and safety. National Eye Center is a one-stop care center for related to eye matters, and it is currently doing a lot of studies on how to delay myopia among the young children in Singapore. So amongst the many young audience out there, some of you may have visited SNEC from time to time in the younger days if you have myopic issues. At Singapore Community Hospitals, there is a network of 3 hospitals, the Bright Vision Hospitals, Sengkang Community Hospitals, and Outram Community Hospitals. Over here is a step-down care whereby patients from the acute hospital after discharge will come to this community hospitals to go for rehabilitative care, after which they'll be discharged and return to their home. Polyclinic is for primary health care. In Singh Health, the network of 8 polyclinics. From here, you can tell that we have over in the east at Bedok, Bukit Merah, Marine Parade, Outram, Pasir Ris, Sengkang, Tampines, and Nuhs. So what are the future plans for Singh Health? As I mentioned, SGH is into its 200th anniversary this year. So being the largest oldest, it's time to do some renewal. So there are many things that happen taking place in the Singapore largest medical campus when it's completed. So starting with the Outram Community Hospital, which was opened in early last year, is already being an operational phase. The second one will be the National Cancer Center, which will be operational by 2022. Initially supposed to be 2021, but due to the COVID, there was some delay in the construction. And number 3, we have the Emergency Medicine Building and NNI, which is coming up at Outram campus too. And of course, last but not least, the new Is Nhg campus building will be ready by the new Is Nhg campus, which started with elective care, will be ready in 2024. But overall, Is Nhg building will be ready by 2030. So this is how phase 2 I mentioned just about 2030, where Is Nhg should be developed at phase 2. Then meanwhile, KK also be undergoing expansion, and same as NNI. As mentioned just now, the new NCCS building will be ready, and over there there'll be a proton therapy center, which is actually a new form of cancer treatment for patients. For those who are interested in primary health care, you'll be interested to know that there'll be more polyclinics being built up in the next 7 years. So there'll be new one coming up in Kaki Bukit, as well as Tampines North. And currently we have the Bukit Merah Outram Polyclinics will be redeveloped into a new one at Tiong Bahru. And meanwhile, the existing polyclinics at Pasir Ris and Sengkang also undergoing redevelopment. And so you can see that over at Outram campus, we have the new elective care center, emergency building, NNI, as well as SGH building. Over at the east, 2027, there will be a new Eastern General and Community Hospital being developed. This hospital will be near the Bedok North MRT stations. Show you the new development, as I mentioned just now. Where will it be for the polyclinics? So by then, there'll be 10 polyclinics within the Singh Health Group. Then EC is also undergoing expansion. There'll be 14 operating theaters up from 10, and there'll be more day wards, chairs, incliners, and there'll be actually a bigger capacity to take care of the patients. As you know that this is actually preparing for the aging population. As more people age, there will be cases to do with cataract as well as glaucoma. So that's why there's a need for SNEC to expand the facilities. from the current building to a Boyer block. And the new integrated general and community hospital in East will be ready by 2030. This is a new hospital that will help to ease the patient load at Changi General Hospital and to cater to the needs of the Singaporeans in the East. So what I mentioned just now, mainly the infrastructure. So about Nhg, what is it about our patient care that we need more people to look after our patients? In Nhg, we work very closely with Duke NUS to create the Nhg Duke Annual Disease Centers. At these disease centers, we are looking at medical, not the individual medical condition of a patient, but as a disease. So patients with multiple conditions will be treated collectively with a team of a multidisciplinary team of doctors, nurses, and allied health, and also pool resources and talents across the different institutions and based on specialties. In such case, there will be common treatments protocol, there will be standard training and structured training and standards to handle the medical condition, as well as there will be joint accountability across all the clinical partners. And with extensive databases of robust and detailed data, we can work closely with NUS to look into better treatment of patients, especially being an academic medical center. We need to take care of patients with new treatment and new services, and research is actually a very key component in our medical care. As I mentioned just now, we have partnered Duke NUS to form the disease centers. So currently there are 9 with the head and neck, which is actually an integrated method into, I think above the shoulder. We have the lung, the breast and diabetic, blood cancer, sleep matters, sports exercise medicine, transplant matter, and genomic medicine. I'll briefly share with you the next 2 slides. What is it that's so unique about this Nhg Duke Annual Disease Center, which actually is a cluster-wide, multidisciplinary and multi-site integrated practice that provide care around the patient's medical condition, needs, and lifestyle. For head and neck disease centers, we have actually the medical, they are actually altogether 8 medical disciplines to look after such matters. So you have the pediatric, which involve children, the ENT, the ear, nose, and throat, with the cancer. Under cancer, you have surgical cancer, medical cancer, radiation, oncology, and especially also imaging. Then over at pathology, it deals with the organs and the blood. You have the head and neck pathology, and it also include the dental, oral, and maxillofacial surgery. Well, how does dental come about? It's because for some patients with cancer of the nose, cancer of the mouth, actually involve the jaw operations. So while treating such cancer patients, the dental specialist must come in also to work with the cancer doctors to provide care for the patient. Besides the medical treatment, we also need to involve a big group of multidisciplinary team from the nurses as well as the allied health professionals. So in the nurses, we have nursing specialties from specializing in oncology, in ENT, and blood matters. And of course, when our patients are sick, under different medical conditions, we involve the physiotherapists, a dietitian, a wound care nurse, social worker, speech therapists, and even clinical psychologists to look after the medical condition. So when a patient has head and neck related diseases, it's a whole team of multidisciplinary people coming together to provide a care. So for such cases, all these specialties will come together to look into the patient disease instead of the patient going to different specialty to seek treatment. And then over at Diabetic Center, we have a one-stop diabetic and metabolism center whereby we look into patients, leveraging technology, we prepare them at the pre-diabetic stage. And when they are entering the early diabetic stage, how we handle them. And of course, there'll be some people who are in late stages of the diabetics, and we provide a comprehensive care for them. So for those who already had a diabetic condition, there will be doctors coming from the endocrines, renal medicine, internal medicine, vascular surgery, and look into them. Then of course, they also be involved with eyes, the vitreoretinal services, and then because it is diabetic, it may also affect their kidneys. Then meanwhile, we do have to have special diabetic nurses to look after the care because we know that sometimes for diabetic patients, they have gangrene feet as well as so-called medical conditions around the feet issues. So the podiatrist will be involved. And that diet plays a very important part for diabetic patients. So that's where dietitians come in too. And of course, they may need to exercise after post-surgery for diabetic patients. That's where physiotherapists will come in. So when treating diabetic patients, we do have all these multidisciplinary people coming together to look after them. Okay, so I move into the various patient care. So now I'll talk about the professional group in Singh Health. In Singh Health, we are very proud and very loud to shout out that the nurses, they are the pride of Singh Health. Why is it so? In Singh Health, the nurses are not just nurses, they're actually specialized nurses. So anyone who is keen to become a nurse will have a chance to get their specialization to advanced diploma or postgraduate certification. And then after working as a nurse for a few years upon graduation, the nurses will have a chance to get into whichever specialty they would like to focus on to develop a career further. So if you come across some official information, you have clinical nurses, educational nurses, management nurses, and research nurses. But in Singh Health, we've gone one step up in the sense that we have actually provide another pathway for informatic nurses. That means that nurses who are keen to look into informatic methods using data to provide better patient care, they can focus to become informatic nurses. And for nursing, we always encourage students and adults out there that nursing is not a profession that is a very so-called paper entry qualification based. It provides opportunity for anyone coming in from ITE, diploma, as well as with a degree. So for a person coming out from ITE, you can start your career as an enrolled nurse. But along the way, if you get a chance to upgrade yourself to become, to do a diploma or degree, then you can become a staff nurse. And then from there, you move on to become senior staff nurse and become an assistant clinician. And where senior, you may give, upon reaching certain seniority, you'll be given a chance to choose which career track you would like to. In clinical, you look after mainly the patients. For education, you are actually an educator. You're teaching the next generation of nurses in schools, as well as to further and enhance the education and clinical skills development of the staff. As a management nurse, you look into the resource management in the wards as well as the nurses development. For research, is looking at ways of improving patient nursing care. And ultimately, you can move on to become a director of nursing, a chief nurse, as well as a group chief nurse of Singh Health. As a chief nurse, you're actually the head, the #1 nurse of each institution. And Singh Health being the cluster, the group chief nurse is a chief nurse among all the chief nurses, leading the nursing professions in Singh Health. Okay, besides nursing, the other clinical track a person can take is the allied health professionals. In Singh Health, why do we use the tagline, many talents, one passion? That's because in Singh Health, there are altogether 31 AHP specialties. So over at scholarship, we only offer a selected scholarship for some of these specialties, but for some of this, for the other specialties, there will be opportunity for other people to embark onto upon your graduation with other general degree. All this information can be found at the Singh Health career portal website. Similar to nursing, allied health professionals also have a career track whereby after they have moved on to a senior position, they also can take on the management role, the clinical role, the research role, as well as education role. Okay, I believe our MOH colleagues have mentioned about healthcare scholarship just now. So I'll just move on to Singh Health, to cluster sponsorship, which is managed by institutions. So if a person is not able to get a scholarship, there are still opportunities for cluster sponsorship, whereby you can still be getting a monthly allowance for your studying, and you can select the institution which you want to join upon graduation right from the beginning. So cluster sponsorship technically is actually a sponsorship by the respective hospitals, as mentioned just now, amongst the group of institutions in Singh Health, and they will pay for you a monthly allowance of up to $1,000, and you're provided with medical examination fees and vaccination fees, and students with good results can get study awards. And for the bond, for classes sponsorship, it's actually ranging from a 1-year bond to 4 years, depending on the number of years of award. Generally, it's the typical bond period is a 1-year sponsorship, 1-year bond. As mentioned just now, sponsorship is offered at ITE level, diploma level, and degree. So for NITEC, the monthly allowance will be $750. And over at Allied Health sponsorship, the following disciplines are being offered. You have diagnostic radiography, studying at SIT, medical social work at NUS or SUSS, occupational therapy, physiotherapy, radiotherapy also being studied at SIT. So to be able to apply for sponsorship, the student need to be a Singapore citizen or permanent resident with a generally good results. And then we'll go through interview and you'll offer sponsorship to students who have a good fit for the institutions. So if you're keen to apply, you can scan here with a QR code or visit our website under careers portal and look for a sponsorship overview. Then you can find more information about sponsorship and how to apply for that. So these are general sponsorship and scholarship inquiries. Is at scholarship@singhhealth.com.sg. Okay, what I mentioned earlier is mainly at students, but besides students, I believe some of the audience today may be working adults, and if you're looking for a switch to a healthcare career as a mid-career switch, you can actually consider healthcare, and it's never too late. And you can actually embark on the professional conversion program, which is actually managed by WSG Workforce Singapore and MOAH. So for those who are keen to take up nursing, there will be 2 pathways you can do under enrolled nurse. You study at ITE, or to become a registered, who might study for diploma at NUS or study for degree at, you study for diploma at NYP or you study for degree at NUS. For Allied Health, there will also be PCP for diagnostic radiography, medical social work, physiotherapy, and occupational therapy. So in Singh Health, what is actually driving us to do what we're doing? It's because what we do is always centered around the patients, and for all patients at the heart of all we do. So I thank you very much for joining me this afternoon for this session. So I will now move over to take on Q&A from the floor. Thank you.
Thank you very much, Luan, for your presentation. Okay, we have about 5 minutes for questions. To start off, can I ask you a question? Since I saw that slide on Singh Health, the part of Singh Health being the nurses. Then you have your Changi General Hospital, you have your Outram Community Hospital. What are the qualities required of nurses in the acute care versus the community care setting?
Okay, over at the acute, first of all, you must know the different type. Also for the acute setting, it's mainly those so-called inpatient complex medical situations. For the nurses, post-surgery A&E matters. So generally, these are the nurses who, for a start, to be a nurse, you must be compassionate. You must really want to care for people first. And that is the number one thing. And you must be very patient and good communication skills. There's this underlying for all the nurses in all the different kind of setting, but just the environment is different. So over at the acute setting, because of the fast turnaround of the nurses, because they are mainly so-called surgery, a few days recovery, then they move out. So it's a pretty fast-paced place. So people who work in the hospital, first of all, they must, in the acute setting, they must be able to take the faster pace. And they are so-called, and they have to be always thinking of the feet because of the patients. And also, they need to be able to, and then they always continuous studying to learn new medical cases and the new development in the nursing. Over at the community care, because these are step-down care, the nurses, the patients will be coming in more on the rehabilitative. That means they may be after a kneecap surgery. So instead of now post-surgery, whereby it's more maybe very drowsy, weaker, they are now in the community hospital setting to do rehabilitation, whereby they work together with the physiotherapists to exercise to improve their strength. So the environment is a bit different. So the kind of patients, the kind of the patient profile is different. But being in public hospital, whether it's acute hospitals or the community care, we always have very anxious caregivers. So regardless, so the nurses must still be very patient, have good communication skills to talk, able to explain things clearly to the patient's caregiver wherever they are. Yep.
Thank you, Soo Luan. We have another question from someone. Would you still suggest a student to take up a sponsorship if he or she does not score good O-level results as mentioned in the requirements just now?
Okay, for O-level results, after O-level, it will be applying for the Integrated Nursing Scholarship, which is for O-level. So that one, I think MOH will have their own cut-off already. So then when they move on to the diploma to study, then they'll be subject, then the result will be based on their poly results, not the O-level results. So they must have a decent grade, decent GPAs while they're in the polytechnic. So that is we believe that with the O-level, they can make it to the poly, and that is at the poly, is depending on how they perform the poly, then we use the poly results to assess them.
Okay, thank you. We have one last question as we are coming to 3:30. What are the academic requirements for poly students, diploma holders for the Singh Allied Health sponsorship?
Okay, for sponsorship, it's offered only when they are in school. Usually we take using the year 1, SEM 1 results. So for allied health, definitely you need to have an A-level or diploma in order to get yourself enrolled into SIT. Then we'll use your year 1, SEM 1 SIT results to determine your suitability for sponsorship. Yeah.
Yeah. Okay. Thank you, Soo Luan. We have come to the end of the session. For the audience, do note that the sessions will be on replay. You can replay if you missed out some information. Soo Luan, thank you for your time today.
Thank you, Nigel. Thank you.
Thank you.
Bye-bye.
Bye-bye. For the next segment, we'll be having Ling Chi Meng, manager at NHG. So he's the human resource manager there. Chi Meng, please.
Hello, good afternoon, everyone. So I'm Chi Meng here. I'm from the National Healthcare Group, representing Group HR. So we'll be sharing a little bit on what is NHG and our care model in terms of our duty to our patients, right? So I'll just bring everyone through. So in NHG, we believe in adding years of healthy life. This vision pretty much guides how we arrange our care delivery. We don't see it as episodical, but we really see it more as a continuous process, pretty much from being a very well-activated individual to the point you suffer from an illness or disease and right down to the end of your life. So during this entire, I'll call it life process, our duty is to make sure that you live well and towards where we call it dying well as well. So this period pretty much encapsulates what it means for NHG in terms of how we arrange our care model. So just a little bit about ourselves. Our mission is really to improve health and reduce illnesses through patient-centered quality healthcare that is accessible, making sure everyone has access to it. And our care processes are seamless, comprehensive, appropriate, and cost-effective. So with all this all in mind, we also need to make sure that our environment for our staff is conducive for continuous learning and also adding that in together with research. So that is how we believe within NHG as well. In terms of our corporate core values, we are pretty much guided by our vision and mission. So henceforth, we are really have, our core values really centered around these 4 key areas: people-centeredness, integrity, compassion, as well as stewardship. Not just in terms of our work, but stewardship of our patients when they come in through the door as well. All right. So before I share a little bit more on the suites, more in detail, just to give everyone a little bit of where is NHG. So this chart pretty much represents where are all our institutions. Primarily, you will see inside the red colors, so there will be the hospitals, namely Tan Tock Seng, Khoo Teck Puat, as well as the upcoming new Woodlands Health Campus. In addition to those hospitals, we do have our supporting units, example, our primary care function, which is NHG polyclinics. And we also have our national centers, namely IMH, Institute of Mental Health, and National Skin Center. So in addition to that, we also do have other supplementary functions, example like our NHG diagnostics, NHG pharmacy, as well as some of our partners as well. So this entire piece comes together to be what we know as NHG itself, right? So just a little bit background, I think probably Sok Luan just now earlier covered a little bit. So in the earlier days when our public healthcare was divided into 6 clusters, in 2017, I think MOH actually decided that it would be more effective to recluster the public healthcare system. So in 2017, we underwent through a recluster exercise. So instead of 6, we have now simplified the whole entire healthcare system into 3 clusters, namely the East, the Central, where NHG is, as well as the West. So we actually merged with Alexandra Health back then to combine what we know as NHG group right now. Okay, so before I dwell a little bit more, I will start to touch a little bit on how NHG is organized within a central region. So for a start, I will first start off in the central region, where we call ourselves the upcoming health city Novena. This health city pretty much is a very exciting development. Works are still in progress. So on the screen itself, towards the left side is where the current Singh Hospital is. And you will actually see the National Center for Infectious Disease smack right in the middle. These are current buildings that we have actually finished. And also towards a little bit more to the top left will be the Renzi Hospital. The rest of the entire health city currently is actually under development. The intention is really to make this whole plot of land that you see right now on the screen evolve into a place whereby what probably this particular slide encapsulates. It's really a place for healing. It's also a place for leisure, and also a place to meet, as well as for enrichment. So those words that is in gray pretty much are all the supporting structures that the whole planning has gone into it, so that we can continue to make this whole location a very uniquely vibrant, as well as allowing our patients to recover and recuperate while they are in our premises, right? In terms of the services that the central region provides, there is really a combination of different care settings. Example, there is the hospital, Tan Tock Seng itself, the primary care, and there is also the intermediate care, which is really flanked by all the nursing homes around the area, and also end-of-life and long-term care. There is also transitional care and community care services that is pretty much provided in the central region. So that's in a snapshot what we have right in the middle. So I will move a little bit next to the area, the north region. So where there's one piece, we call it Is Nhg Health. So for Is Nhg Health, there are 3 units there. So anchored really pretty much by Khoo Teck Puat Hospital, which is linked to the Is Nhg Community Hospital. A little bit more to the right side then would be the Admiralty Medical Center. So Khoo Teck Puat itself actually form a network of care model so that they can integrate the entire community into the Is Nhg region. So I will go into a little bit more in the next slide. So this particular slide will explain how Khoo Teck Puat looks like. From the picture, you probably will note that it's a very interesting hospital where a lot of greenery has been integrated. And in fact, the hospital itself is integrated with the pond beside it. And they have actually adopted the pond as part of its care model, because they believe that integrating nature is one way to rehabilitate our patient. So that is how, when during the construction of the hospital itself, that was how they have done it. So I will go a little bit on how the care model works between Khoo Teck Puat and Is Nhg Community Hospital works. So typically, a patient is admitted to Khoo Teck Puat for acute episode. So they will get themselves addressed, cured, as well as diagnosed. And what happened is when the patient's condition has stabilized, the Is Nhg Community Hospital, which is linked to Khoo Teck Puat Hospital, they will actually transfer them over where patients are needed to stay on for a little bit more care. If the patient is deemed well enough to be discharged, then probably the patient will be discharged for a post follow-up separately. So when the patient eventually moves over to Yishun Community Hospital, there is this whole ecosystem whereby they will continue to be cared for as if they are in a hospital. And the whole area is designed such that it allows a very holistic care to be given to our patients. Example, they will actually do use holistic care, example like arts and music therapy. And what happens is eventually when patients are discharged home, there is actually follow-up care through aging in place for our geriatric patients. And they also do specialist outpatient clinic follow-ups and also wellness kampong. So probably some of you may be wondering what is wellness kampong then. So just to share a little bit, it is an initiative undertaken by our Khoo Teck Puat Hospital, whereby they come up to create a kampong model. So what happened is there are a lot of so-called such kampong being initiated, whereby the patients can actually check in, and they can also look out for signs. And they also create something like a wellness initiative, like healthy cooking, and also daycare centers, so that they make sure that our so-called residents in the north can be self-activated to take care of their health as well. So that is something that our Yishun health so-called area has actually very deliberately modeled. I will just move on next to our newest hospital that is still under construction. So Woodlands Health Campus. So this particular new hospital scheduled to open sometime in 2023 is something a little bit of an unusual, different hospital to be exact. It doesn't really have demarcation saying it is an acute hospital or is it a community hospital. In fact, when they designed the care model, it is really integrated. So there is this oneness of the services. So the intent is really looking at right from the start, where a patient doesn't even become a patient from the onset. They are really looking at preventive care. So you take care of yourself and try to prevent yourself from coming into the hospital. So, so there is a lot of focus towards that. And eventually, if you do come into the hospital, then the flow itself will go through seamlessly. And the other unique feature for Woodlands Health Campus is they actually leverage very heavily on technology because what happened is that they are mindful that there is always manpower crunch within the healthcare system. And leveraging technology is really one way we can make sure that care can be more effective to our patients. Right? So that will pretty much cover the 3 hospitals that is under the National Healthcare Group. I will just move on a little bit to our primary care, where NHGP will take care of our population in the central region. So NHGP plays a very crucial role as our care model continues to evolve, whereby we are no longer so-called the acute hospital at the first point of visitation for our patient. In fact, we are trying to devolve into a primary care model whereby the polyclinics together with the GPs can build so-called try to manage the illness and sickness of our population before eventually it goes towards the hospitals. Okay. The other 2 centers then probably I will be covering a little bit on is the first one will be Institute of Mental Health. I think what happened is that mental health is slowly coming to the forefront in terms of healthcare issues for our population. So right now within Singapore, IMH is the only national center for mental health. So in case any one of you is really seriously considering a career in the area of mental health, then probably I would actually encourage some of you to explore a career with under the Institute of Mental Health as well. Okay. The other center that we have would be the National Skin Center. So currently, the Skin Center looks after the general skin condition. They also have an outpost, so-called at Kelantan and Kelantan Lane, whereby they will do a skin test. And what happened is that the National Skin Center is currently undergoing renovation, and it is scheduled to open in 2022. So with a bigger center, they will be able to take in more patients as it comes. And then lastly, before I cover the entire suite of the health options, healthcare delivery options that we have, will be the 2 items, the NHG diagnostics as well as our NHG pharmacy. These are our two business units under NHG Group. They provide very, very specialized services to our partners. And they, for diagnostics, they are considered as a one-stop imaging and lab services. That example, they provide services to our NHGP polyclinics and also for pharmacy as well. So for some of you who are considering a career in a lab technician, a med lab technician, or even a pharmacist, but you do not like to be so-called bounded to a hospital, you may want to consider an option under these two functions as well. All right. Then what happened is that after I've gone through the entire suite of services, I think our care model is really encapsulated together with our vision through this, what we call as the river of life, our model of care. So how we actually read this particular very complicated chart is on the top side will be the system excellence. So it's really about how we organize our care in terms of the hardware. So example, how do we make sure we cover the zones? Example, the Singh Hospital, the Kutepot Hospital, that's taken care of how we organize in terms of physical and technical areas. So in the middle is what we call our activated patient. That's the round shape structure in the model. So we also look at how can we make our patients become more self-aware? How can they take better care of themselves? So at the bottom itself is where what we call the system health. And that's the part whereby I'll go a little bit more into it in the later part, in the next few slides, where we go a little bit more into how we take care of our people. So there are really a lot of different elements. So we look at how can we create value, how can we create knowledge for our staff so that we can continue to give strong and quality care to our patients. We also look at how can we build a system of talents, and also how can we rejuvenate our leadership as well. So that is in a nutshell how to read this very so-called complicated, busy chart. Yeah. So just to share a little bit on in terms of our professional staffing strength, as of now, currently we have a staff strength of approximately around close to 20,000. So mainly we have broken down into these four major categories. We have the doctors, we have the nurses, the allied health, as well as our administrators. All in all, these are all the groups of people that we have. And in terms of ensuring our staff that they are well taken care, even though, in the course of doing work, we do not forget how to play as well and how to celebrate also. So there are a lot of interinstitutional games. We also celebrate contributions of our staff and those very best that we have. And we also do not forget to party, and through D&Ds and also Nurses Day. And we also do philanthropy, for example, Cyclists with a Heart initiatives. In terms of professional development, we also place a very strong focus on how to make sure our staff can continue to grow. So we do have various so-called schemes in place. Example, the Health Manpower Development Program, the Clinical Practice Improvement Programs. We also do offer scholarships for masters and PhD for local and overseas placement centers. And we also do provide clinical attachments to well-known medical centers, so that as a professional, eventually, if you do join us, you do have this option and opportunity to go and learn what does it mean for others who have done so well. And if there are opportunities for you to bring all some of these skills, technology back to Singapore, and then we can adopt them and for our local patients' benefits. And there's also in-service training, and there is also overseas and local seminars. So that pretty much covers all my presentation. Before I end my presentation and move over to the Q&A segment, just want to so-called encourage every one of you to consider a career in healthcare, and to join our so-called growing family. So healthcare is really in demand for a lot of professionals. So there's no better way for some of you who are really exploring your options right now to consider. And probably during this fight with COVID, I think it makes a lot of meaning, and for you to give back eventually to the population at large. All right, yeah.
Thank you, Chiming, for your sharing. We'll now go to the Q&A. We do have some questions One of the questions is, if I'm interested in NHG diagnostics, what university course would be applicable?
So for the so-called, I think there is actually a program under the NUS program that you can actually apply to. And I believe under the MOH Healthcare Scholarship, it is actually one of the so-called supported programs under there as well. Yeah. So I do note that there is also another question, I think, for pertaining to IMH as well, if I'm not wrong.
Correct.
So I noted there is this question on if I'm interested in mental well-being, does only IMH provide such services or other institution under NHG look into mental wellness? So just to share, well, IMH is technically the National Center for Mental Health. Within NHG itself, our hospital example, Tan Tock Seng and also YH, as well as our upcoming Woodlands Health Campus, they do have so-called psychology department also. So it is actually possible that you do not need to ring fence yourself in a way just to IMH, but you can continue to serve in other departments also, in other locations. Yeah.
Okay, Chimi, I'm going to ask you a question. The question is, which allied health discipline should I choose since, we are already in this aging population?
Okay, so allied health is actually a very, very big discipline. So for a start, I think if you're looking at geriatrics, probably some of the potential ones could be occupational therapists. There is definitely that growing demand as our elders need to learn and relearn how to apply some of what we call daily activities. That's one of that. I think nursing continues to be a very critical area. So that's another area that probably you may want to consider. Probably digressing a little bit. I think nursing is really much more than just what we see in the hospital. There is this growing focus towards community nursing, even I'll call it palliative nursing, which does do home visits as well. Yeah. And even, for example, I think diagnostic radiography is another one. And also, for example, probably pharmacies. I think as we continue to change, a lot of the care models will continue to evolve. I think probably to round off the question, there isn't so-called what we call a growing need, but I think across the whole healthcare spectrum, it is really a system. There is no individualized being singled out, I'll call it. Yep.
Okay, we have another question. I will answer that. So the question is, I'm looking into a scholarship that's provided by KTPH. How do we go about that if I'm a poly student? So to answer that question, right, you will have to apply to healthcare scholarships. During your applications, you'll be able to indicate which cluster and institute you prefer. So if you're successful, we'll work with you to allocate you to the cluster. But do note that we have manpower restraints, so you might not always get your first choice. Okay, other questions. NHG, do you currently have volunteer or job shadowing opportunities available?
For this question, actually we do. We used to host it, entertain it, such requests. But what happened is that I think due to current COVID situation, we have actually put them on hold for now. So I do note that I think during, for example, during yesterday's Bright Sparks career fair, there are actually questions, but we do actually encourage you to write in. Maybe there could be opportunities, so-called later down the road. So we could still entertain subsequently, but currently it's actually put on hold right now. Yep.
Right. Thank you, Chiming. As shared earlier, right, I do think if you want to get a glimpse into the healthcare sector, you can look for a part-time job or you can look for a job in the Careers SG job portal. I think there's a lot of healthcare related jobs just to get a glimpse into the sector. Okay, let me look at the questions. Right, we don't have any questions as of now. So to the participants, right, do ask your questions. Now you can upvote as well. Maybe since we are here, Chiming, I'd like to ask you as well. We have a few people asking about healthcare administration scholarships earlier today. How would the healthcare administration scholarships be allocated to clusters? Where would they be working at that sort of thing? Maybe you could shed some light into this area.
Right. So I think for healthcare administration scholarship, primarily, first and foremost, I think at the cluster level, probably address it from a cluster level. So annually, we do call out to within our departments and hospitals if there is any need for such profiles. So normally they will review, and then what happens is that we will see what is being demanded from them. So in terms of the types of administrators that we look at, it's actually quite broad ranging. So example, in the past, we have taken in people who are doing business subjects. Example, like finance, HR, analytics. We have also seen some engineering students, and there are also facility students as well. So in terms of administration, that is actually really quite broad ranging. Yeah.
Thank you, Chi Ming. We have another question to NHG. What kinds of qualities do you look for in a job applicant?
So in terms of the quality, I think the passion to want to care, I think it's something that's very, very critical. In fact, this is something that probably most of you need to ask yourself, really, because you shouldn't be guided by what we call monetary returns. Because very fast, you do find yourself potentially maybe facing burnout. But I think likewise, when we interact with our scholars, most of them have shared that the joy from a patient recovering under their care is something that is very, very crucial in driving them and motivating them. So that's something that I think probably is something that we do look out for. The second part is it kind of ties in back as well. Resilience. Healthcare can be challenging while we try to explore ways to make our job more effective and efficient and easier. But nonetheless, it is still a very demanding job. So the tenacity part really comes in there. And the last quality probably is being open to feedback. I think healthcare is really evolving. Our population is changing and the demands are changing correspondingly as well. So I think the key part is really being adaptable and being able to take feedback and evolve. So these are the three key areas that I think probably you may need to ask yourself.
Thank you, Chi Ming. We have another question, so I would answer that and maybe later I'll ask you as well. What advice would you give on which cluster should I choose for my scholarship application? So the advice I have would firstly be to check out which specialty you might want to be in. So for example, if you want to do mental health as a nurse, maybe going to NHG, going to IMH might be a good thing. Or if you want to be like, let's say a pediatric nurse, going to KKH might be good. They're under Singh Health. So I need to advise though, these sort of specialties do only occur after you have been through some clinical experience. It's not immediately that you get to specialize. The second advice would be location. I think the three clusters are situated across Singapore in different locations, north and the east and the west side. So location is something that you can consider as well. So Chi Ming, have any advice like why should they choose NHG for their application?
So I think pretty much you address quite a fair bit. First and foremost, I think if you do have a genuine interest in where you want to do, example, I'll probably call out a few specialties that we know. P&O, I think NHG itself will remain the only healthcare institution right now that has a P&O center. So P&O remains what we call a niche, very niche area that NHG provides. If you're thinking of a career in mental health, likewise, we have the National Center there, IMH, and also probably in terms of emergency department, Singh is really the biggest, the most busiest, I'll call it, emergency department in Singapore. So if you like to experience a very, very fast-paced, high-dynamic area, then probably Singh is one of those areas. So that's what I call a first question that you need to ask yourself. If you're not too sure, but you're still very, very keen in a career in healthcare, probably go with what you want to do first. And the next question then probably is try to see whether am I comfortable to apply for a job that is near to my place. Reason because I think, for example, if I were to put this example, if you are staying in Changi and you want to work in maybe, for example, in the West, maybe, for example, Nuh, you may be spending a lot of time traveling on the train or the bus. You will find yourself getting very, very tired eventually as well. So for practicality, we have also tried to make allocate scholars that is given to us to the best that we can, that is near to your residence as well. So that's something that we try to do very, very deliberately also. So nonetheless, if you feel that subsequently, what if I don't want to do, example, maybe I want to explore something that's above, beyond. Eventually, when you come back from your studies and you find that you want to specialize in something that, example, I'll use back maybe mental health. You may find that I want to do mental health and I'm willing to go to IMH example. Probably normally what we advise really is serve out your bond first. And then while you are finishing your bond itself, do trigger a discussion with your reporting officer that probably mental health is something that you are really, really passionate with, or maybe example, emergency department. Have a discussion with your reporting officer. Explore whether can you be transferred over, because such things are always open for discussion and it's not cast in stone. But at the forefront, I think normally we advise scholars that first and foremost, your obligation is to complete your studies, excel in it, come back and contribute to your core obligation before you explore anything else. So that's something that I thought I can share very upfront.
Yep. Thank you, Chiming, for sharing. Yeah, I think one of the good things about being allocated to a cluster is a number of institutions and specialty centers that come with it. So there'll be rotations, there'll be certain deployments that you can look forward to. Although, like Chiming pointed out, do discuss it with your supervisor at that point of time. We have come to the end of the Q&A session for Chiming. Thank you very much, Chiming, for joining us today.
Thank you, Nigel. Thank you, everyone.
Yep. For the next segment, we'll be having Lau Ming-er, who is a nurse educator at Nuhs. So a nurse educator means that she has already completed her general nursing. She has gone through a clinical. She has now specialized as a nurse educator in the nursing track. So you might want to ask her questions pertaining to nursing, pertaining to the career paths. I think she'll be able to advise on those questions. Ms. Lau, please.
Thank you, Nigel. Okay. Hi, everyone. My name is Ming-er. I'm a nurse educator with Jerome Health Campus. It's under the National University Health System. So today I'm going to share with you about my campus, Jerome Health Campus, as an integrated healthcare development. So a little bit about myself. My name is Ming-er. I'm a nurse educator with the General Hospital. I have a total of 12 years of nursing experience and I'm specialized in emergency nursing. So Jerome Health Campus basically consists of General Hospital and Jerome Community Hospital. We are the first hospitals in Singapore designed and built together as an integrated healthcare development. So this integration actually will transform the way of healthcare is provided to the community to deliver patient-centered service in a seamless manner. For example, a patient who is acutely ill will be admitted to our General Hospital. And if they do require follow-up care, like subacute care, they will be transferred to the Jerome Community Hospital, which is just located to the next tower. So this integration actually complements for better patient care, greater efficiency, as well as convenience. So this is a little bit of virtual tour of how Jerome Health Campus look like. We have total of 3 towers, Tower A, Tower B, and Tower C. So let's look at Tower A. Is actually our General Hospital Clinic Tower. So basically the outpatient services will be located in this tower. So Tower B located in the middle. So it is actually the General Hospital Ward Tower. We have total of 16 levels. So we provide emergency care, intensive care, as well as operating theatre that's located between level 1 and level 4. And level 5 to level 16 onward is our inpatient wards. For Jerome Community Hospital, this is located at Tower C. And we have total of 12 levels. So we have 400 beds catered to subacute care patients. So a little bit about what disciplines do we have for our nurses to work in. So we have inpatient units. This is available in both Ng Teng Fong General Hospital and Jurong Community Hospitals. So let's look at Ng Teng Fong General Hospital. We have medical wards, surgical wards. We have an isolation ward, which is located next door to our emergency department. This is to prevent cross-contamination in case we have patients who require isolation facilities. We also have multidisciplinary wards, ambulatory wards, kidney unit, intensive care unit, as well as high dependency unit. So for Jurong Community Hospital, we provide subacute care and rehabilitation care. So a little bit about the inpatient wards. So the first picture actually shows you a general outlook of how our inpatient facilities look like. And it's very spacious, and the selling point is actually every patient would have a window. So the idea of the window is to provide natural light to aid patients' recovery and to promote time of the day for our patient. So the patient would know that whether this is a daytime or nighttime. So the spaciousness of our inpatient ward actually optimize infection control. We have an integrated haze management system for all our subsidized ward in both Tower B and Tower C. We also provide emergency and critical care services, for example, emergency medicine unit, intensive care unit, and high dependency unit. So our intensive care unit and high dependency unit is actually a combined critical care facility, which I will share more in the upcoming slides. So for emergency department, we are pandemic prepared, decontamination and mass casualty ready for industrial accident, because we are located at the Jurong East area. We are very, very close to the industrial area in the Jurong Island. So at the bottom here, this diagram actually shows that we have this dedicated trauma lift built inside our emergency department itself. So this dedicated trauma lift is to transport our critically ill patient to either operating theater located at level 3 or ICU located at level 4. So these two lifts actually allow our patient to reach to the critical care unit easier, okay, as compared to the normal bed lift, which we need to wait for quite some time. So this is very ideal for our critically ill patient. And just now, like what I mentioned, we are very close. We're just next door to the isolation ward. This is to minimize cross-contamination if the patient are required to be nursed in the isolation facilities. So for the intensive care unit and high dependency unit, we are actually the combined critical care facility. Combined meaning to say, if any patient requires, for example, this patient is admitted to the ICU and needed a downgrade care to the high dependency unit, we need not transfer the patient out of the ICU to the high dependency unit. All our nurses need to do is to switch a tag. So in the sense that it's very flexible, that we can convert the services between ICU and high D. So we actually reduce the need of transfer patient out of the unit itself. We also have an attached healing garden outside our ICU and high dependency unit. So this healing garden is very special. We actually allow our patient, our ICU or high D patient, those are more stable, to actually receive some sunlight, okay? Because attached to our healing garden, we actually have code blue buttons just in case the patient have any emergency. The nurses or doctors or allied health professional can actually activate the code blue easily. Okay, aside from the inpatient unit, the emergency department, ICU and high D, we also provide ambulatory service such as the specialist outpatient clinic located at Tower A. We also have radiology for both inpatient and outpatient. So I have covered Tower A and Tower B. So let me introduce you Jerome Community Hospital, which is located at Tower C. This is a 400-bed facility that offers subacute and rehabilitative care. So this Jerome Community Hospital actually complements the care provided by Ng Teng Fong General Hospital, so that patient who requires longer subacute care can recuperate in the setting that caters to their needs. So in the Jerome Community Hospital, we actually have this area called the Life Hub. So this Life Hub actually aims to help our patients to remain healthy and independent at home. So for example, in this Life Hub itself, we have actually a 3-room HDB mock-up. This is actually real mock-up. As you can see in the second picture here, we actually have a living area, kitchen, and also a dining area. This is actually a real mock-up to serve our patient to ease back their home environment under the guidance of our therapies, for example, like our occupational therapies. We also have this mobility park in Jerome Community Hospital. We are first in Singapore, and this mobility park actually have a simulated MRT cabin, simulated bus cabin, to actually allow our patient to utilize this area. For example, they require, they need to know how to mobilize themselves using wheelchair, using crutches. So our physiotherapists will actually book this area to make sure that our patients are ready before they discharge back to the community. So aside from Jerome Community Hospital, we also have perioperative services. We have operating theatre, endoscopy, as well as central sterile supplies department. So for scholars who are interested in the perioperative services, we do provide this range of services in the hospital as well. All right, so just I have covered the facade and the facilities of Nhg General Hospital and Jerome Community Hospital. Now I would like to introduce you of the impact of digital transformation on the flow of operations in Nhg General Hospital and Jerome Community Hospital. So I'm not sure if you have heard of this electronic medical record system, the NG-EMR, which is called the Next Generation Electronic Medical Record System. So Jerome Health Campus is the first hospital who adopt this NG-EMR. So this NG-EMR is actually MOH vision to transform one Singapore to one healthcare record. So our hospital has utilized this NG-EMR successfully since last year, February. So NG-EMR is actually a fully integrated electronic medical record system which shares our patient information seamlessly. So in this one system itself, we covers multiple modules to allow our physician, our nurses, the allied healthcare professional to better share the patient's information seamlessly. So some modules like physician order entry, the emergency department, operating theatre. So basically anyone who has this access to NG-EMR can access the patient's information with just one click. Aside from the NG-EMR, we also have self-service kiosks. For example, all our patients and next of kin would need to be registered in order to gain entry to our services and the inpatient area. So our visitors can actually register themselves via the visitor self-registration kiosk. And aside from the self-registration kiosk, we also provide counter services. The next system which I would like to mention about is the warehouse management system. So this warehouse management system is actually a quick and easy way for our nurses, our allied healthcare professional to request for a top-up of inventory using an RFID box. So traditionally, without this system, if let's say we require to top up certain inventory, the nurses will need to give a call to our warehouse managers to request for inventory. But with this system, it's very seamless. All the nurses need to do is to just drop this RFID card into this box that you can see in this picture. And it will register into the warehouse management system. So managers who is managing the WMS system will actually send technicians to top up the required items. We also have systems like automated guided vehicles. So in short, this is called the AGV. So this is to help us move inventory to stockroom and delivering meals to our inpatient area without the need of human intervention. This in turn actually can reduce the cost and reduce the manpower costing for our hospital. Another system, which is called the Enterprise Queue Management System, in short, it's called the EQMS. So all patients who is registered in the emergency department or even the specialist outpatient clinic will have this one queue number for all the services throughout the day. So they need not, for example, this patient is required to see a doctor in this clinic A, okay? So he will register himself and this queue number will be generated. So for example, the doctor have seen this patient in clinic A, and the patient is required to do an X-ray at the radiology department. So all the patient need to do is to have this same queue number and present himself to the radiology unit without the need to register one more time. So the same queue number will be used throughout the patient's entire day of visit. Another system worth mentioning is the real-time location system. So this is actually RFID tags worn by our patients as well as physical assets. So this helps to track our patients' location and high-value equipment. One more system that I would like to mention is the inpatient pharmacy automation system. So this is actually a system that enables medication safety and to improve the medication dispensing and administering process. So our nurses will just need to go into this automated dispensing cabinet, register with their ID, and then key in the patient's name or NRIC number, and whatever medication that is ordered by our doctor will be reflected into the system, and the nurses will just need to pick the medication accordingly and load into this this picture. This is called the medication card on the right hand side, and then they will bring this medication card to the patient's bedside, verify the two identifier before administering the right medications to the patient. Okay, this is my final technology that I would like to mention. This is the latest. On the left-hand side, you will see robots on patrol, and the left-hand and the other picture mentions the drones. So we are leveraging on technology and IoT as well as artificial intelligence to help drive efficiency, productivity, and safety. So for instance, we utilize the robot. This robot actually makes patrol around the campus to ensure security. It's able to identify any thing that is left unattended and report accordingly to the command center. As well as the drones, it uses to inspect the facade, the building facade of our hospital, which requires maintenance. And this actually, it is relatively safer for the technician as well as save time. So I have come to the end of my sharing. Basically, this sharing want to introduce about Jerome Health Campus and as a facility, and as well as the range of services that we provide. So thank you very much. I've come to the end of my presentation. If you like more information, you can connect me via LinkedIn through this QR code. Thank you.
Thank you, Ms. Lau, for your sharing. That was very insightful. Okay, we have questions. So before I ask the questions, right? I think most questions are regarding the ER department. Okay, so maybe this question you can take together. How many ER departments are there in Singapore, and what made you decide to work in the ER?
Okay. So my background, right? Okay, actually, I started off as an emergency department registered nurse with National University Hospital. That is part of Nuhs as well. So what makes me want to join the emergency department? Because I like the adrenaline rush, and I like a fast-paced working environment. So, and most importantly, honestly speaking, I like aircon environment. so emergency department is like the ideal place for me. So I had my final posting as a student nurse at the emergency department at NUH, and I like it very much. I enjoyed the final posting a lot, and I transit myself to a registered nurse in the emergency department. Yeah.
Okay.
So, question.
Yep. How many ER departments are there? Any idea?
In Singapore, I think all restructured hospitals have an emergency department.
Yeah.
And Untitled General Hospital, we have one, but we only have the adult emergency. So whereas for NUH, we have the adult emergency as well as children emergency. Yeah. So I think the rest of the hospital, like Tan Tock Seng, Kutik Puat, all these, we have emergency department. Even the private setting, they also have an emergency department. Yeah.
Okay, thank you. Benedict Chua asks, is working in the ER more stressful than in other wards?
I can't speak for other wards, but definitely working in the emergency department requires you to be ready at all time. And because we can't expect what cases is going to come next, whether we have any acute emergency, for example, that's going to be sent by our colleagues from the SCDF. Okay, so we have to be always ready, and most importantly, we cannot close our door and say, "Hey, we are full house. We can't receive any more patients." So we can't do that. So as an ER nurse, you need to be always ready, and always ready, and teamwork is very, very important. Yeah. So whereas is it more stressful than other department? I think it's different stress, and which I think every area would have to manage it. Yeah.
Thank you, Ms. Lau. Another question, would you say that the emotional burden of working as a nurse is greater than that of a doctor?
I have many colleagues who are doctors as well. I think most importantly is to support one another. The job scope is very, very, very different between nurses and doctors, because doctors will go and clerk the patient, see the patient and then order. So for nurses, aside from carrying out the intervention, we are there most of the time with our patient. And most importantly, we are looking at advocating for our patients as nurses. So because we are always there with our patient, we spend more time with our patient, we will be able to understand the social aspect, as in, because the patient spend longer time with us, they may chit chat with us. So as nurses, I think we need to be able to advocate for our patients and bridge the gap to address our patients' need. Yeah. So emotional burden, I think I don't I don't see it as a burden, but there are stressful moments. For example, let me quote my own example. Like I could be resuscitating a very young patient, for example, a 3-month-old infant. Okay, the child was brought in pulseless, no breathing. So I have to resuscitate this child. And looking at this infant, it's very stressful. So we need to manage the burden, and then just administering the care. And after that, let's say this child that I'm quoting, she didn't make it. She passed away. Okay, and after that, we need to brace ourselves to actually console the next of kin. Okay, which is what a nurses need to do, because the doctor will break the news and say that, I'm sorry, the patient didn't make it. And then my nurse here is going to tell you what is the next to do. So we are not a robot. So we also have emotion, but we just need to brace ourselves and then bring our patient family members through this ordeal. So for example, like a child that is 3 months old is quite traumatic for the parents. So we need to be there to support the parents. In a sense, we need to call in our MSW colleague. We need to be there instead of traditionally we will say, oh, we will allow about 1 to 2 hours time, viewing time for you to be with the patient. But for this child who is 3 months old, the mother will say, can I carry my child who is dead? Okay, we can't say straight away no. Okay, but although it's strongly discouraged, because if it's a coroner's case, we are not allowed to move out anything from the patient. Okay, but in this case, can we look at another manner? Can we be with the mother and the infant who have just passed away, to allow the mother to grieve and carry the baby for just the 1 hour, 2 hour. Yes, we can. So that is a thing that nurses would need to think out of the box to manage this. Yeah.
Thank you very much, Ms. Lau. I can really feel the empathy you would have displayed. Yeah, and I agree also. I have next of kin, who needs to go for regular drawing of blood. It's interesting because when he talks to the doctor, he'll be like, "Oh, can I ask for this particular missy? She draw blood, very painless, very like it's just very nice." Then the doctor will be like, "Huh, how come everyone is also the same?" Then he say, "No, no, no, no. This one really very gentle, very talks to me." So it's quite I guess the care is very direct, very relational, very different. Okay, so we have a couple of questions with regards to being a nurse educator, APN, and also a nurse practitioner. So the first one is, why do you choose to be a nurse educator other than an APN? The next one is, how long does it take to be a nurse educator? And another one is, are there opportunities to be a nurse practitioner in Singapore? I think you can sort of combine your answers. So maybe you want to talk about the career track and things like that.
Okay, so the main tracks that we have is education, clinician, as well as management. Okay, so we have nurse educator, nurse clinician, and nurse manager. Advanced practice nurse is under the clinician track, however, is another license on top of a registered nurse license. So in order to become an advanced practice nurse, you will need to undergo the Masters of Nursing. In Singapore, of course, it's done by National University of Singapore. Okay, and then you will need to go through I think it's a 18 months program currently. And then once you graduated from the program, you will need to do internship with the hospital. And then I think the internship is about a year, if I'm not wrong. And then you have to go through like OSCE, the national examination, in order to become a full-fledged advanced practice nurse. So as of the question, why do I choose to become a nurse educator? So like where I started in the emergency department, and I'm very interested in education in the sense that I like to share my knowledge, clinical knowledge with my juniors. So my reporting officer back then is also a nurse educator. So she so-called, I would like to emulate her, because I think that aside from the clinical care that she provides for our patient, she also coach and guide the juniors like me. Like sharing of knowledge is really wonderful. So aside from caring for our patient, I get to learn from her a lot. Okay, and then from there, during career discussion, she actually asked me, so which track do you like? That is like an every year thing your manager will ask you. So for me, I say, I'm actually interested in education track. So how can I progress from where I am as a staff nurse? So she said that, okay, let's take one step at a time. And if you're interested in guiding your juniors, maybe I can send you to become a clinical instructor. So a clinical instructor is actually an opportunity for me to instruct the nursing students, okay, at an emergency department setting. So I learned how to coach, guide, provide feedback for my nursing students. And from there, I think more and more, I'm like more developed into this field. So, and then she said that, okay, why not you think about it? Maybe you can become a nurse educator. So from there, I actually further progressed myself. So I'm trained in emergency. So emergency nursing, I'm specialized in that field. So after that, she said, why not you go and take up the postgraduate diploma in higher education. So this actually gives me an insight of how education, I can translate the education better to my nurses. So, and then I joined Nhg General Hospital after about 6 years as a clinical nurse in emergency department. And then from there, I actually learned a lot about lesson planning, conducting a formal class, and then guiding my nursing students and junior nurses. And then, yeah, how long did I take to become a nurse educator? I took about 10 years. I would say every nurse's progress would be different, okay? Of course, the progression and promotion is, aside from the qualification that you need to attain, you also need to be recognized in terms of your job merits, you know, your performance at work. Yeah, so all these will be considered lah. I won't say that the number of years apply to everyone, but I think for me, myself, I took about 10 years from a staff nurse to a nurse educator.
Thank you, Ms. Lau. I think we will take a couple of last questions. We are almost at the end.
Okay.
Maybe a quick one. How did you become a nurse in the ER, and do you choose to get to work in the ER after you graduated?
Okay, so I'm very fortunate because I graduated from NYP. So my year was the year whereby I can choose which department I would like to work in lah. So NYP actually gave me 3 choices. So he say, oh, you can put like medical unit, surgical unit, or whatever unit. So for me, I like emergency a lot. So my first, second, third choice, I put emergency. And I still recall my clinical facilitator actually look at the paper and ask me, hey, Ming, why your first, second, third choice is the same? I say, teacher, I really like to work in the emergency department. So I don't want anywhere else but ED. So yeah, and I'm very fortunate that I'm able to practice in the emergency department, and yeah.
Okay, thank you. One last one, I think then we'll close the NUHS session. What does a nurse clinician do?
What does a nurse clinician do? So nurse clinician actually takes care, for example, 100%. So 80% of a nurse clinician role is to look at the patient's care, okay, and then supervise the ground nurses working in the clinical setting to ensure standards and to ensure that the patient's care is being carried out promptly and carefully. And then the 20% would be managerial part of the setting.
Okay, thank you, Ms. Lau. I think we will answer any more questions.
Okay.
So thank you for sharing with us on your experience and all the cool AI presentations. I think some of them did ask questions on that, but we couldn't take them because we have no more time.
Sure.
So Ms. Lau, thank you very much. We have come to the end.
Thank you, Nigel. Thank you all.
So for the next segment, we will be having Derek Tan, who is the Chief of Manpower and Talent Division for the Agency for Integrated Care. So Derek, please.
Hi, good afternoon. I'm very happy to meet all of you virtually on a Sunday afternoon. And first and foremost, I want to congratulate all the A-level graduates for achieving your excellent results. I mean, it has been reported in the news that this year's cohort has achieved far better results, and especially in an environment where it's very challenging. Okay, so a little bit about myself. I'm Derek. I'm from the Manpower and Talent Division of Agency for Integrated Care. So what I do is I oversee the overall manpower development as well as the talent management and development initiative for the Comcare sector. And I will be spending the next 30 minutes with all of you sharing about the Comcare sector, and also to give you a glimpse into what the Comcare sector does, and also point you to how you can make a difference in the Comcare sector. But before that, I thought it would be good for us to take a look at a video which AIC has produced, and I will resume my sharing after the video. So can we have the video, please?
Care What makes it so special?
How is it, Mr. Peter?
Is it the way it makes us feel? How it makes us smile? No. The special thing about care is that it doesn't care. It doesn't care who you are, where you're from.
Is everything okay?
It doesn't care if you're family or a complete stranger. It doesn't care how difficult things get.
Where is it?
It always pulls through.
Slowly, slowly. Okay, slowly, yeah. How? Good job. Okay.
You see, care is not something only found in the best of us.
Take it slowly, okay? Well done.
It lives in all of us.
Yep.
Okay, I hope you enjoyed the video. But essentially, the video highlights the key message that I want to share with you today. And that's essentially that every one of us are born to care. And for you to embark on a career in the Comcare sector, you are in a way born to embark in that career itself. So other than that, one key reasons why you should join the Comcare sector, or why you should be considering a career in the Comcare sector, I will go on to share a couple more reasons for you to take it back and think through in the next couple of days. Firstly, and I'm quite sure this would have already been covered in the MOHH presentation as well as in the cluster's presentation, we are all mindful of the key challenges that the Singapore healthcare system is facing. So other than just, and it's not just about the population is aging, it's also that people are living longer and having increasing chronic condition as well. With smaller family sizes as well, which then in a way put a strain in the family caregiving responsibility as well as the family caregivers. So, and not just that the challenges that the Singapore healthcare is facing and with regards to aging population, if you look at the needs of our seniors, it has also continued to grow, and not just in terms of numbers, but also in terms of complexity. So you see that more and more of our seniors may have dementia, and you also see, and that sort of complicate the entire demand for healthcare services, right? You know that senior typically require a longer healthcare stay in the, whether it's in the hospitals or in the community. And other than just having that longer stay, some will come with dementia as well. And increasingly, there will be other issues that relate to their psychosocial that will come along. So beyond just the numbers also, I think increasingly we also realize that it's not just, we shouldn't be just taking care of the seniors when they are frail and they need care, but it's also how do we also look at fulfilling the aspiration of some of our seniors, and in a way then convert aging as a positive force. So these are the three reasons I would share, and as a consideration why you should consider a career in the Comcare sector. Now what I'll do is I'll share a little bit of what we do in the Comcare sector, and allow me to first start by giving an introduction to what AIC does. And I do like the the refreshed AIC vision mission statement, and that aptly captures what we do in AIC. If you look at the mission statement itself, is comprises of two parts. On the left-hand side is about empowering seniors and clients, and on the right-hand side is about transforming the care community. So on the left-hand side is really about how AIC wants to reach out to our seniors and engage our seniors and be the voices of our seniors, as well as our related client. And when we say client, it could be those caregivers who have caregiving responsibility of the seniors in their home. On the right-hand side, when we talk about transforming the care community, it's about AIC working with the Comcare sector and making sure that the services that are put in place do meet our seniors' need, and that when we deliver the care services in the Comcare sector, is delivered in a safe environment. So that's largely what AIC currently does for the Comcare sector and for our seniors and our clients. And so the AIC exists because we support the MOH strategic shift. So you will be familiar with the Healthcare 2020, which is about improving accessibility, quality, and affordability. And recently also, MOH started to announce the 3 Beyonds. And of the 3 Beyonds, I think AIC play a critical role in supporting the move beyond hospital to community. We are also involved in supporting the move beyond healthcare to health. So the clients or the seniors that we look after ranges from the well and active to the pre-fail to the frail, and then also then to look at the end of life requirements for our seniors. So maybe I'll introduce the Comcare sectors and our partners, and you will see that they are broadly categorized into 3 types of, based on the services that they provide to our seniors. So there, on the left, you have the center-based services, and this comprises of the daycare center. So the childcare equivalent, but cater to seniors. So they could be centers who looks at providing activities and social daycare, or it could be centers that provide more care-related kind of care-related services to our seniors. So such as the senior care centers. Then you have the home-based care, and the home-based care basically what they does is they will send either the healthcare professionals or the support care staff to the homes of our seniors to provide the necessary care as well as services to our senior who are based at home. And to the right, the residential-based care, and these are for seniors who may require a longer recovery over at our resident-based facilities such as community hospitals and nursing homes. So other than looking after those seniors who are frail and require more higher level of care, what we are also doing now is to build community and networks to enable our seniors to live and age in the community by having both agencies within the community as well as working with AIC to ensure that seniors can participate in what we call active aging program, and also having services such as befriending. And if let's say seniors require some kind of a care, then to look at how do we then support them with the appropriate and the necessary care in the community. And of course, the last piece of work is about digitization, is how do we go about enabling our seniors to embrace digitization as we move along in our journey towards 2030. So in a way, given that I only have 30 minutes with you, I thought that few slides broadly just give you a glimpse of what the Comcast sector does. And if in a way that kind of trigger some interest in you, what you could do is then follow up with us with regards to your queries, and then we can then see how we can point you to the necessary places for information. So to conclude, in a way, how can you make a difference? One, if you are really interested in shaping the future of the Comcare sector, and the second reason being that I've kind of explained that the three beyond, one of the beyond is about moving beyond hospital to community. So as you can see, there is increasing focus in MOHN to move towards community. So that in a way gives you the second reasons for you to want to make a difference. And I think beyond just taking care of the seniors when they're frail, I think what we want to do is also to support and empower Singaporeans to be able to live and age actively and act healthily. Yeah, so what makes Comcare unique, as you can see, we are part of the larger healthcare ecosystem, and healthcare is evergreen. It is also a growing sector. It's growing because Singapore is facing an aging population, and there's increasing healthcare needs. Second is within healthcare itself, there's diverse career exposure and experiences. Thirdly, we are moving beyond just care, but also look at, or rather we are moving beyond just looking at the health aspects of care, but increasingly to look at the psychosocial aspect of care in the Comcare sector. And I think the last point about, in Comcare sector, what is so different is that you are actually journeying with the clients or with the seniors as they move on with their life. So you're not just making an impact to the seniors at that particular point when they need the episodic care, but because it's long-term care and because it's we are also caring for them in the community, it allows you to build that relationship with the seniors. So it's not just about making an impact at that particular point in time, but you're making an impact journeying with the seniors through a significant, I would say that a part of their life which will probably be where the caregiver will really appreciate to journey with them. So if you want to find out more, one avenue is to go to Healthcare Scholarship, where you can look up Comcare Scholarship and Com Nursing Scholarship. You can also look at the Comcare Manpower Development Award for information about both for the scholarship as well as the award. We are also conducting a few virtual experience session as well as info session. Do take note of the information on the slides. If you want to hear from our Comcast partners, join us for the virtual experience from the 1st to the 3rd of March. If you want to find out more as well, come down to SMU as well for the info session on the 6th and the 13th of March. So look out for more information on the Mosaic Facebook for information on the learning journey as well as the experiential program. And lastly, if you are interested to come for the info session, do quickly register via the code on the screen. We will be having the 2 sessions. Both will be conducted at the SMU Admin Building Level 4. So because of the current COVID situation, the spaces are only limited to 30 seats per session. So do RSVP ASAP if you're interested to come down for the info session. With that, I will end my sharing and perhaps get some questions and we can have that dialogue going.
Thank you very much, Derek, for your sharing. I think some of the questions were, where can I volunteer? Where can I go and see? I think Derek answered that question. You can go and attend the info sessions that they are organizing. So there are some questions. Derek, maybe we start off by answering this one. Do I get the chance to rotate across the different care settings if I join the Comcare sector?
Okay, you will, as part of the Comcare scholarship as well as the Com Nursing scholarship, and as part of that whole career planning and career development program that will be put in place to support those who are successful in the scholarship, you will get a chance to be rotated to the acute or to the public healthcare sector to get a 6 months posting for you to, in a way, be assimilated to what your profession does in the acute setting before you come back to the Comcare sectors. And within the Comcare sector, it also really depends on, so maybe what I'll say is within the Comcare sector, you'll be assigned to a Comcare organization. As far as possible, when we select the Comcare organization, in a way, we also make sure that some of our Comcare organizations are able to provide an internal postings that will straddle across different settings. So there are a couple of what we call multi-service Comcare providers who are existingly providing services, say running a nursing home, right, together with Com Hall as well as senior care centers. So within the organization, so that there will be chance, definitely we will explore for you to be rotated within the organization if it's a multi-service provider. If it's not a multi-service provider, then I will be quite upfront now to say that it is a journey that we will have to journey with you, and we will have to find, I mean, depending on your interest, find that necessary, that opportunity for you to be rotated outside of your organization if the Comcare organization is a single service provider.
Thank you, Derek. We have another question. Is it true that you need to be independent if working in the community? Where will I get guidance from? I think this question is linked to the one also on, will a patient turn violent at home? You know, how to overcome this?
Okay, so definitely in the Comcare sector, and because, so two things that sort of contributed to the need for you to be relatively more independent. One is also because in terms of resources, is in a way right size to match the care needed at the Comcare sector. So most of the Comcare sectors, they don't really need complex and episodic and intense kind of a care. Most of our seniors, they have, when they are transferred to the Comcare sector, their medical condition would have already been stabilized. So what they do need is just a period in time for them to slowly recover. And because the care is, the intensity of the care is relatively lower than what you see in the acute sector, the level of care supervision or the care provision would, of course, then have to be calibrated accordingly. So it does require you that for you to, in a way, as a result of that care calibration downwards, it does require you to be more independent, be able to do more things with at times supervision, minimum supervision. So, and this includes the home care scenario, right? And what I do understand for some of the home care provider is before they allow you or before they let you to conduct a home visit on your own, there will be a supervisor that will go along with you, just to make sure that there is, especially in your first visit, because you do need to establish that rapport and relationship with the client. So your supervisor will definitely be following you for the first visit, and depending on how well you can manage the situation at the home environment, then the supervision will definitely be slowly taper off. So I hope that kind of explained the questions about the need for independence. Yeah, I mean, so if you look at the differences between the acute as well as the Comcare sector definitely requires people who can think on the feet and be more independent. Yeah, because you do operate in an environment where, in terms of the supervision, it's not as readily available as what you will see in the acute setting.
Thank you, Derek. We have another question. Will we only work in nursing home in Comcare, and what are the medical careers we can have there? So I think I answered the first part of the question. I think Derek mentioned that that we will send you for attachment in acute settings. There are various Comcare organizations. It's not only nursing homes, so there are various places like step-down care, home-based care. So it's quite a huge range of settings you can work in. Derek, maybe you want to elaborate on the medical careers?
Okay, I suppose the person who refers to medical as is referring to the healthcare professional in general, or rather, I'll answer the question based on the healthcare professional perspective. If you are referring to the career as in doctor's career, we don't have many doctors in the Comcare sector, but we do have quite a sizable number of nurses, and we do need quite a sizable number of nurses also in the sector. We also do need physiotherapy, occupational therapy, and speech therapy, because these AHP professions are critical in helping our seniors to recover from their medical condition before they can be transited back at home. So if you are referring to the nursing career, yes, definitely there's some level of diversity within Comcare sector, but it would not be as elaborated as the acute hospitals. But definitely within the Comcare sector, there are specializations that nurses can sort of embark on. And some of these would be, for example, palliative care. Palliative nursing is quite specialized areas, and what I can also think of is perhaps also nurses who wants to specialize in dementia care, because yeah, so those are I would say sub-specialization within Comcare sector that if you're keen, you can explore. For the physio, occupation and speech therapists, I would say that the clinical specialization would be a lot more geriatric focused, because a large part of your clients will be the seniors, and the large part of the conditions that they face will be largely related to seniors as well.
Thank you, Derek. Another question. Does AIC help coordinate the shift in the healthcare industry from acute to primary care?
Yes, so AIC does look at, so when we look at the whole integrated care perspective, is also about integrating more upstream. So I do have colleagues who are in charge of looking at transforming the primary care and looking at how we can also move care from upstream to the primary care. So we do have colleagues who works in the space of primary care and yeah, looking at how we can integrate primary care into the larger healthcare ecosystem.
Thank you, Derek. We have a question which I can answer. Maybe Derek, you can elaborate as well. So the question is, will community nurse earn lesser than nurse working in the hospital? I think that is changing rapidly. I think if you read last year, there was Parliament and they're actually raising the benefits and incentive of community nurse and community staff. So I do think they are having a competitive salary now. Maybe Derek, you want to elaborate?
Yeah, so the MOH does support the Comcare sector to make sure that, or to level up the salary to make sure that the sector is on par with the public healthcare sector. So it's an ongoing effort, and you'll probably hear from the Committee of Supply debate as well, that this salary enhancement exercise are ongoing. We do have regular conversation with our MOH counterparts as well to make sure that the salary in general remain competitive, not just only for Comcare sector, but also for the whole larger healthcare ecosystem.
Okay, so we'll go to Derek for one last question, but I see some questions there. I'll answer quickly. Can I apply for HMA and join the Comcare sector, or I can only apply for CCS and CCS and CNS? You're able to apply for HME and join the Comcare sector. That is true, but it's more for the acute setting. So be working in the cluster com hospital. If your passion is in community care, the CCS and CNS will expose you to a much different and wider Comcare setting. Qualities you should possess. I think that's now Derek answered. Maybe the last question, which is a personal one, is Derek, why did you join AIC?
Why do I join AIC?
Or the Comcare sector, for example.
Why did I join? Okay, so I think so maybe I'll just share it from the point of view that in the first place, why did I join healthcare, and then eventually make a switch to AIC. So I was with MOHH for the past, I think easily 8-9 years. And the whole reasons why I joined MOH or the healthcare sector itself, because there is a lot of meaning behind whatever you do in healthcare. And you know that you're actually making an impact to the clients, whether is it a young person recovering from an injury, or is it a senior? So in a way, what I would say that firstly, why I join healthcare, why I join Comcare is, one is because the job gives you a lot of, the job is meaningful. So, and you're not exactly chasing after profit. What you're doing, you're making an impact and you're making a change to somebody's life. So that's important to me. And probably the second reason why I kind of moved from MOH to AIC is because I want to be closer to the agency that really is in charge of making aging a lot more pleasant, a journey for Singaporeans. And part of the reason is personal, because I do have elderly mom, and I'm sure most of you here, or at some point in your time, you will have an elderly parents to take care of. So in a way, I'm a caregiver because I have elderly parents that I need to take care of. And so I want to make sure that I'm in a place where I can make the most impact to how she can be supported for her aging journey. So whether is it, and she's well now, so I'm very happy that there are programs that helps her to stay active, help her to remain connected through the befriending program to the community, such that she doesn't feel isolated or feel lonely if I'm not around. Yeah. So in a way, AIC is probably the best place to, because they are making a lot of these changes to the ecosystem. And for me, the third area is manpower and talent, because that has been my passion, right? And the reason why I kind of signed up the HR career is because you're making the most direct impact to a person's career and life. Just like what we are doing now, a lot of us, I think, wants to spend the weekend afternoon here because I think we are making a deliberate effort to want to let everyone who is on this seminar knows what kind of careers both the Comcare as well as the public healthcare can offer. Yeah, so that would be the three reasons why I joined AIC, or maybe why I joined the healthcare sector.
Thank you very much, Derek, for sharing. It's great to know that your mother is doing well. We have come to the end of our sharing, Derek's sharing as well. Derek, thank you very much for sharing with us. So you may take your leave now. Thank you. Bye-bye. Okay, so everyone, it's 5 p.m. We have come to the end of this session and we hope that you have benefited from the sharing. If you have enjoyed the session, please take a few seconds to rate the program at the bottom left of your screen. Our next session tomorrow, Learn and Explore Various Healthcare Disciplines with SIT, is at 9 a.m. From what I know, it will be an exciting one. There will be a virtual campus and lab tour and an actual anatomy class by the teaching staff at SIT. You'll get to learn more about the application process, curriculum, student life from our scholars at SIT. So do tune in tomorrow at 9 a.m. Do note there's also a contest going on in the contest section. There are 16 people who have responded. Take part in it to win a $10 Grab food voucher. And with that, we have come to the very end of the session. Thank you very much for joining us on this Sunday. Have a good evening and stay safe.